you. I'm an advocate, and I hear these stories over and over, hundreds, thousands of them over the years. But today, this is my story. And even though it's my story, I need for you to understand and realize that there are thousands of patients out there who this experience will resonate with. I was nearly bedridden for the better part of 8 years due to my chronic pain and other health conditions. Doctor after doctor had given up on me. I faced the bias and judgment as it was doled out on a regular basis. Drug seeker, non-compliant, difficult, faking. And of course, children don't experience pain like real people. There was times where I found someone to treat my pain, but then I was at risk of the treatments that didn't work or side effects. Oh, the side effects. After weeks and months of nausea, vomiting, diarrhea, shakes, headaches, stomach digestion problems, trembling, insomnia, etc., etc., I would complain loud enough. And when I did, we ended that treatment. It was always my fault. I failed the treatment. Perhaps maybe the problem wasn't the treatment, it was the patient. I heard it so many times, but I think probably the worst sound was the sound of doctors giving up on you. It sounded like this. Maybe try yoga. Have you considered exercising? The reality is it wasn't part of a multimodal approach. It was the last sound you saw or heard before you couldn't get another appointment. I got lucky, luckier than most. I found a doctor who was willing to treat my pain. He gave me some relief and allowed me the freedom to fight back. And for the first time in my entire life, I was able to access resources that I needed, find help, learn and educate myself with a cheerleader at my side. He supported me in the decisions that I made. He helped me when I was struggling, and he was there to fix it when things went wrong. I was safe. I had persevered, and I was proud of myself. Along the same time, the guidelines for opioid prescribing had spread out across North America. I lost my doctor. I used long-term opioid therapy as part of my treatment plan. I knew that finding a new doctor was going to be difficult. I suspected the bias and the judgment would be worse. Even I had no idea what I was about to experience. You see, I became one of the unintended consequences. I spent 3 months searching for a doctor. I was out trying my very best. Doctor after doctor was refusing my care. I heard excuses over and over again. Excuses like, we don't treat pain patients. We're too busy. You're too complex. I can't think of anything else to try that you haven't tried. They wouldn't even prescribe my thyroid medication. They simply didn't want to be attached to my file. And of course, there was a judgment and the bias. And I heard the tropes over and over again coming at me in rapid succession. Addict, drug seeker, your type of patient. Patients who are willing get better. If you're not better, you're not willing. It was a bombardment of it. Things got worse. Dangerous, in fact. Doctors were making clinical decisions and diagnoses without any kind of workup, without any kind of assessment in the first 10 minutes of knowing me. They hadn't looked through my file. They didn't know my history, but they were confident in a diagnosis of personality disorders, opioid use disorder, personality disorders, and some rare autoimmune disorders that I've never heard of, and of course, don't have a treatment. Then, over and over, I heard doctors tell me, step one, we have to remove your brain tumor. They didn't really know me. They hadn't followed me. And they certainly hadn't looked at the letter from the neurosurgeon in my file. When I made it clear that that was not an option, they told me not to worry. They knew somebody. We would just look for a different doctor who would take it out. in that 5 minutes, 10 minutes, 15 minutes, they made a medical diagnosis or 2 or 3, made medical recommendations for dangerous treatments, and things did not feel very safe. But it got worse. It got worse for many of us, because then I heard that they couldn't or they wouldn't treat me. It became clearly obvious that there were more than just the doctor and I in the room that day. There was a doctor, myself, a regulatory body, and a guideline that was supposed to advise on opioid prescribing. What was also clear is that decisions being made in that office had absolutely nothing to do with me. By January 28th, I free fell off my opioid. Without help, without assistance, and without medical care. By January 15th, I had run out of all medications for all of my health conditions, and I still didn't have medical care. I went on and on searching for a doctor, but now I had to do it in crisis. I wasn't sure how to do this. I couldn't go back, I couldn't quit, but at the same time, to trudge forward meant to subject myself to more of the worst that medicine had to offer. My headaches got worse. I had my first seizure in 10 years. I had an adrenal crisis. My hormones were out of whack. I couldn't sleep. I was throwing up blood. I was weak. I desperately clung to the practices that I had used for self-management over the years, the ones that had helped me get out of bed, but they were failing me. I was failing. Not 1, not 2, not 3 times. I often say 60, but my husband reminds me 67 doctors refused me care. He reminds me because all he could do was watch as I came home appointment after appointment, broken and hurting. By the time 4 months of this had gone on, my grandson went to his teacher. He said, when our bird died, I put it in a little box, but he was concerned because he didn't have a box big enough for me. That is the moment of deepest despair. That is the moment that so many patients across North America and around the world turn to the street for relief. They commit suicide because there is no hope. I was incredibly fortunate, and a very good doctor took over my care. He began treating me. It took him 2 years to stabilize the damage that had been done, at least the damage that we could see. Because that free fall from my medication, the lack of medical care, it left silent damage inside. And just as I was regaining my health and fighting back again, I woke up one morning and I threw up out of the blue. And pain started in my chest, and it began to radiate up and up through my jaw, out to the left side of my shoulder. I had cold sweats, nausea. I couldn't catch my breath. It felt like something was sitting on my chest, and the pain was excruciating. At this point, most people would go to an emergency room. I hopefully wished and prayed that it was something like esophageal spasm, something that came up and was miserable, but it would go away. Because the only other alternative was to throw myself back out there, go to an emergency room, and open myself up to more of the bias and judgment. The next morning, 24 hours later, I realized that I needed help. So I went to the emergency room, and it seemed to be going well. The doctor ordered something for pain. He ordered the test that he needed to run. And the nurse walked in, and she held up a syringe in her hand, and she said, "The doctor ordered this. It's Toradol. Let me guess, that doesn't work for you." And in that moment, I knew What they saw before them wasn't a person in distress. What they saw was a problem pain patient, a drug seeker. In that moment, I was no longer safe in that emergency room. They released me. They told me to go home and take more Toradol. They released me before they got the cardiac enzymes back. Later that evening, my doctor asked me, he asked me to go back to another emergency room. This one had a bigger cardiac unit. This is what they do. So I did. But once they looked in my file and saw that I had been prescribed opioids, that I was in an emergency room earlier that day, they left me sitting in an emergency room for 6 hours. It was the worst pain I'd ever felt. I explained it to the nurse that I have literally been kicked in the chest by a cow, and this was worse. When I finally made it to the back, the doctor said, "We don't treat this kind of problem in emergency rooms." I'm not sure what kind of problem he thought he was dealing with. He said, "Now I have to run a cardiac enzyme. I have to do a heart trace, but I'm going to put you in that chair over there. And that's it. That's all. And as soon as they come back, you're going home." I wasn't really sure what was going on at this point. The pain was overwhelming. When they put the leads on my chest, it only took a few moments when my heart rate dropped to 20. Alarms went off. And the people who once stood behind that flimsy curtain and talked about me drug seeking and being a frequent flyer, the ones who made comments about not contributing to my problem, came running in. They said, "It's okay, honey. We're here. You're safe." They said, "Are you okay? Where do you feel pain?" I looked up at my husband and I said, "Shit. Empathy. Am I dying?" And that was the last thing I said before I lost consciousness. I survived. But the fact is, there are a lot of patients who don't. The bias and the stigma results in poor medical decision making. It overrides things that doctors would normally do. It results in patients being sent out of a hospital and having their appendix rupture on the road, or cancer being overlooked because it's brushed off as fibromyalgia. The bias and the stigma is killing us. But what does this mean for you? Imagine now that I have found my way to your office and you don't know my history. So you're sitting at your computer and typing away because we know that your demonic electronic overlords are demanding it of you. And you're prattling out some new medication and which one you're going to stop, what you believe in and what you don't. You're going to ask me to go to some specialty or to go see this other person. And you look up and what you see is you see anger. My lips are pulled back and I'm baring my teeth and my fists are up and I'm ready to fight. And you think, "Oh God, it's going to be a long day." But if you didn't have a conversation with me, if you did not understand the trauma that I have experienced searching and seeking for care and help, what you wouldn't understand is that I'm not a bad patient. I'm not a difficult patient. I'm hurt. I'm war-torn. I'm traumatized. You think, "But I didn't do this to you. Don't I deserve a chance? Don't I deserve an opportunity?" You probably do, and I'm likely going to give you one. But the truth is, it's not that easy to walk away from trauma. It's not easy to pretend it didn't exist. And then somebody will ask me to pee in a cup. And you know what goes through our minds? Really deep down, you want to know what goes through our minds in that moment? Wait, you don't trust us? The fact is that we have patients all over the world who have become an unfortunate and unintended consequence. But we have names and faces and families. We're trying to survive. We're looking for help. We need you to take the time to get to know us, to understand us, to hear us. And if you think it takes a long time, you learned an awful lot about me in under 15 minutes. To those of us who are making policies and decisions, who are creating strategies, the time has come for action. We can't talk about safety networks to catch these people. We can't talk about planning and thinking and educating and advertising. We must have action. We need to teach family doctors how to handle those first appointments. We need to get them the resources that they need to be able to deal with these traumatized patients. We must start now. I hope that by sharing this incredibly painful journey, I have given you an insight, a face to take back to the tables that we all sit at, to take back to your practices. I hope I've humanized those unintentional consequences. Chronic pain, it's heavy to live with. It's hard. But it just shouldn't hurt this bad to find medical care. Thank you.